And the COVID-19 vaccine could become an annual injection, just like the flu shot, if the vaccine immunity studies by researchers and pharmaceutical executives around the world indicate that vaccine immunity wanes off after some time. Now, Kenya is still conducting research on the same in order to guide its policies on the question of booster shots that have generated debate around the world. And as Raquel Muigai reports, the Ministry of Health Cabinet Secretary Mutahi Kagwe wants all county governments to continuously play an active role in ensuring their populations are vaccinated.
7 months since COVID-19 vaccination began here in the country, over 2.9 inoculated Kenyans breathe a collective sigh of relief after receiving either the 1 or 2 dose COVID-19 jab. 947,543 having been fully vaccinated, that just 3.5% of the total adult population. But as the Ministry of Health rushes to get as many people vaccinated as a means to stay ahead of virus evolution and acquire herd immunity, that would necessitate reopening the economy. The question of how long immunity lasts is one that still remains. The Senate Health Committee is seeking to understand what the Ministry of Health was planning on the same.
This is what is being monitored, with a possibility that this may become an annual requirement. If at the end of the 10 months since people got vaccinated, the levels will be low. But as more information comes on the need to have annual vaccination yearly, we will keep Kenyans updated.
On April 15th, Pfizer CEO Albert Bola said people will likely need a booster dose of the vaccine within 12 months of getting fully vaccinated. So did Johnson & Johnson on August 25th, where it announced data supporting the use of its COVID-19 vaccine as a booster shot, boosting 8 months or longer after the primary single-dose vaccination. While these arguments supported the need for annual doses and booster shots among certain researchers and various countries around the world, Kenya wants to conduct its own research on the same.
We have planned to do those studies to monitor the antibody levels following our vaccinations to better inform our policies so that we just don't adapt without local evidence. And in particular, we'll also be looking at the issue of natural immunity to see how far it remains protective.
This comes as 252,000 doses of the Johnson & Johnson vaccine arrived in the country on Wednesday. Doses that are set to support government's effort in vaccinating at least 100,000 people daily.
There are some governors who are very serious about it, but I can also confess here that there are some governors who take the whole thing very lightly, and we have had difficulties, in convincing them that this is as important as it gets.
As the Ministry of Health struggles to deal with the uptake of vaccines in counties where the uptake is still quite low, the issue of vaccine equity still remains a bigger challenge on its plate, given that those vaccinated in Kenya could still face challenges when it comes to travelling outside the country.
At the moment, we are negotiating bilaterally with, for example, the UK, so that we can have our certification recognized by them, and then we can also have their certification recognized by ourselves.
Only 130 persons out of a sample size of 4,869 have tested positive for COVID-19 in the last 24 hours. The positivity rate is 2.7%. Raquel Muigai, Citizen TV.